Do you suffer from pain along the outside of your foot? In this video, I'll be discussing this pain in the feet, especially along the outside of foot, what it means, and how you can help yourself at home. Hi there, my name is Dr. Kristina Turkewitsch and I'm a chiropractor in Newmarket, Ontario, Canada. Welcome to my channel. Now, I love chiropractic care. I love taking care of the spine and the nervous system, and that's what I've specialized in over my last number of years as a chiropractor. But I also like to talk about and discuss other ailments of the body that can be helped through chiropractic. So if you're new to this channel, welcome. I think you'll get a lot of answers to your questions here. Also, if you have any questions, please just feel free to leave comments and contact me, and I would love to help answer your questions or create even videos around questions that you have so you can get the information that you need. Please don't forget to hit that subscribe button and also the like and the bell icon so that you can be notified of any upcoming videos. So what does that mean, pain along the outside of the foot? Well, generally that means that you have or could potentially have flat feet. Because when you have flat feet, you'll feel that pain on that outside edge of the foot. You can also feel pain at the ankle. You can also have swelling in the ankle. And you would notice that, your feet on the inside of your foot would touch the floor, when normally or usually you would have a bit of an arch there. This is called pronation, or sometimes it's called overpronation. So these are terms that are used as well and that you may have heard that talk about basically flat feet or fallen arches. What causes flat feet? Most feet have an upward curve on the inside aspect of the foot, which is between the heel and the ball of the foot. Tendons running from the heel to the ball of the foot, along with the tendons in the lower leg, from muscles in the lower leg, work together to form the arch. When the tendons have the proper amount of tension, your foot will have a normal shaped arch. When they don't, you will have little to no arch, which would be a flat foot or called fallen arches. There are two types of flat feet. You can have a rigid flat foot or a flexible flat foot. In a flexible flat foot, your arch will collapse when you have your weight on it. So when you stand up, you will notice that the arch will fall. When you sit down or take pressure off your feet, the arch will spring back. And this type of a flat foot is very common in children who are much more flexible, right, when they're small, and basically they will eventually outgrow that. And with a rigid flat foot, your foot, no matter how you're weight bearing, so if you stand up, your foot is going to be flat, and if you sit down, your foot is going to be flat. This tends to happen more in adults. Sometimes people are born with a flat foot. So from the womb, the arches, well, even as children, were very flat, and you just kind of continued with that into adulthood, and you notice your feet are flat. Sometimes, usually, it's kind of a hereditary thing. So it's actually just the structure of the foot. Other times, and probably more commonly, your feet develop flat feet later in life, or as you age, you'll develop flat feet. In terms of the nervous system, it's due to lack of information going from the foot. So a decrease in the proprioceptive information from the foot to the brain. So the brain's like, oh, we're not really using this. We're just gonna let it go. The body is amazing at adapting, but unfortunately what happens is it will adapt away from normal, and so you will lose that arch over time. So it's usually lack of signaling to the nervous system, to the brain. Other reasons for flat foot, other than age or your simple foot structure itself, kind of from when you were born, can be a physical issue. So something in the foot where the bones maybe have fused, or there's congenital issues in the foot that created flat feet. So that can also be a reason why you have a flat foot. Also, if you've had any foot or ankle injuries that caused injury to the tendons of the foot or ankle, that can also create a flat foot situation. If you have also nerve damage due to something like diabetes in the foot, so that can create a flat foot as well. So a lot of elderly people can suffer from this because they're diabetic. So they've lost nerve or nerve innervation to the feet. So then the information, again, kind of from the brain can't reach the foot. So you end up having a flat foot. Or in pregnancy can cause flat feet as well, because you have a lot more flexibility in your body because of the hormones that are circulating through your system, preparing your body for giving birth. These can create more flexible tendons and ligaments and joints, because you tend to need that in order to expand your pelvis so that you can give birth, and that that'll work properly. But those hormones don't just affect your pelvis, they affect every single part and joint and ligament in your body, and so you can have fallen arches because of that. Now, if you have a flat foot and it's painful, you have that pain in the foot, what can you do about it? Well, next I'm gonna share with you my top 3 exercises for pain because of flat feet. So I'm just going to explain a little bit about each exercise. So the first one here is towel curls. Now you're going to sit in a chair, ideally with a towel under your feet, and root your heels into the floor as you curl your toes to scrunch up the towel. Press your toes into your foot, hold for a few seconds and release. Make sure to keep the ball of your foot pressed into the floor or towel. Maintain an awareness of the arch of your foot being strengthened. Do 2 to 3 sets of 10 to 15 repetitions. The second exercise is calf raises. So you're going to stand with your feet hip distance apart, and you're just basically going to push through your toes and bring your heels up off the floor and lift your heels as high as you can. And I would do 2 to 3 sets of about 10 or so to 20 repetitions. The third exercise is heel stretches. So for this one, you will stand with your hands resting either on your hips, or if you need some support, you can use a wall, a chair, or a railing. Keep one leg forward and the other leg extended behind you. You're going to press both heels firmly into the floor. Now, keeping your spine straight, bend your front leg and push yourself into the wall or support, feeling a stretch in your back leg and Achilles tendon. So if you're just having your hands on your hips, just bend your front leg forward, keeping your balance, and until you feel that stretch in the back of the leg. You can hold the position for a count of 5 or so, and then go back to the normal position. Or you can do this like a little more quickly as well, like I'm doing here in the video. I would do 4 or 5 sets on one side, and then switch legs. So the other leg is forward, and then repeat. Now I just threw in a bonus exercise here. So this is exercise number 4. This is arch lifts. Now for this one, you're going to stand with your feet hip distance apart. You're going to make sure to keep your toes in contact with the floor the entire time. You're going to roll your weight to the outer edges of your feet as you lift your arches up as far as you can. So you kind of almost like scrunch your toes in as you roll your foot out, and then you release your foot back flat to the floor. So do this 2 to 3 sets of about 10 to 15 repetitions. So there you have it. Those are my top 3 exercises that's going to help with pain along the outside of your foot due to flat feet. So please don't forget to subscribe and click that little bell icon so that you can be notified when future videos arrive. Also, don't forget to leave a comment if you have any questions. Also, if you want to know more or have other questions about flat feet or foot pain in general, so please let me know below. Thanks again and have a wonderful day.